Welcome back. Is it a job creator or a threat to human health? Many in the medical community believe the U.S. decision to leave the Paris Climate Accord is the latter.
That includes the director of the Global Health Institute at UW-Madison. As Dave Delosier tells us, the concern is leaving the Paris Accord will endanger human health.
When it comes to the issue of climate change, opinions vary.
So climate change is happening now.
Global warming and that, a lot of it's a hoax. It's a hoax.
The Trump administration's decision to pull out of the Paris Climate Accord focused on jobs and the economy.
The Paris Climate Accord is simply the latest example of Washington entering into an agreement that disadvantages the United States.
I find it unconscionable that the world's #1 historic greenhouse gas emitter is withdrawing from the Paris Climate Accord.
Dr. Jonathan Patz is the director of the Global Health Institute. From increased spread of diseases to respiratory problems, Dr. Patz sees a health risk in abandoning the Paris Accord.
Where we have mosquito-borne diseases, like malaria, for example, an increase in temperature, we're seeing the disease creeping up in altitude. We're seeing ticks in the Midwest that are moving northward. The Lone Star tick is moving northward, and that carries ehrlichiosis, which is a very severe disease.
Dr. Patz also says continued reliance on fossil fuels will cause more health problems.
When you think of the 7 million people that die worldwide from air pollution, 200,000 in the United States from air pollution. So to shift from dirty energy to clean energy, a low-carbon economy, has an immediate public health benefit.
And from where he sits, this is less about politics and more about human health.
It's a no-brainer as far as clean air and clean energy.
In Madison, this is Dave Delosier, WISC News 3.
Criticism of the decision to leave the Paris Climate Accord is also coming from other health organization leaders, including the president of the American College of Physicians, the CEO of the American Lung Association, and the American Academy of Family Physicians.